So let's deal with the next topic, class teaching on roles and responsibilities of nursing personnel on family health services and information education and communication. So let's deal with the introduction. Introduction of information education and communication. The importance of health education has been increasingly realized during the last 3 decades, much that health education has emerged as a specialty in itself. Means health education is the most important part of the education, because if we educate the local people about the health, so they may take care and they may take precautions to make them prevent from the infectious diseases or health related problems. So that is the introduction of information education and communication. Then next is definition of IEC. Information education communication is an approach which attempts to change or reinforce a set of behavior in a target audience regarding a specific problem in a predefined period of time. So information education and communication are given to those target audience which have some specific health problems or which are infected from the health related problems. So for that people we organize the information education and communication. Then next is objectives of IEC. First point is increase reach of services. Means we have to provide the services to that level to help that people who are suffering from some disease conditions. Then improve the quality of services. Means we have to provide the quality care to that patients or to that clients. Then make supervision more oriented towards problem solving. Means we have to make supervision that what are the problems and what measures we should take to solve their problems. Then link supervision with training at various levels. Then we have to link that supervision, means what problems are there and what procedures we use to solve that problem. So we have to organize some training at various levels. Then concentrate on local field problems both for development of training material and their users. Means we have to concentrate on local field problems, because in local field problems sometimes there are no development and no training materials are used. So we have to provide the development training material and make people to participate in their training programs. Then combine interpersonal communication strategy with mass media approach. Then we have to combine interpersonal communication system with the mass media. Then improve performance level through continuous with village community volunteers. Then we have to improve our performance levels with the village community volunteers. Means most of the pupils are infected and most of the health problems we can see in the community areas. So we have to involve their volunteers with us to improve our performance level, and we have to provide awareness program and training programs in the community levels. Then importance of information education communication. First point is it create awareness, increase knowledge and change attitudes. Means important. What is the importance of information education and communication? It create awareness and it increase the knowledge and change in attitudes. Means if we create awareness programs and we organize awareness programs at the community levels or village levels, so people may get aware about the health problems, about the infectious disease and what are the management of that infectious diseases, and they may increase their knowledge and they may try to apply that management and that prevention care in their day-to-day life. So it brings changes in their attitudes. Second, it is not expensive. Information education communication is very cheaper. Okay. Then it ensures feedback mechanism. Means when people gets improved by applying that health awareness, by applying their preventive measures or management in their day-to-day life, so they may get improved, so they may observe improvement in their health, so they may get feedback to you. Then major component of IEC. Means what are the major components of IEC? First, visit schedule. Means we have to visit time to time or weekly or monthly. Okay. Then training, we have to provide training to the community level or village level workers. Then supervision, we have to supervise what are the health problems and how can we take then how can we manage that health problems in that area. Then monitoring and evaluation means we have to monitor, and after that we have to evaluate that health problems in the community level or village level. Then next point is planning and IEC strategy means we have to plan for which kind of IEC strategy should be used at the particular area. First, IEC success when it is planned with a comprehensive strategy. Means we have to plan that how we can make our IEC successful. What may be the strategy and what are the particular points we should keep in mind so we can organize our IEC programs in the village level or community levels, and how it can be effective to the village level workers or community level peoples. Then gain knowledge and incorporate community tradition means we have to gain knowledge and incorporate community tradition. There must be true dialogue means what we have to say that must be specific. We can't take some movie dialogues or some other things in our information, education, communication system. Everything cannot be changed at once and focus on relevancy means what we should do that each particulars cannot change in means everything we cannot change, but we should focus on the relevancy means what we can change there, we have to focus on that points. It should be cost effective. Camping for preventive behavior, fear arousal needs to be used with caution. Means sometimes village people have get fear that why we can use this and why we can after using these preventive measures or after using these medicines it may be a side effect to our health, and it may not be useful to improve our health, and why we can use this, no? So we have to prevent that arousal means that fear of arousal. Okay, we have to tell the benefits and we have to show the examples and we have to demonstrate but properly to them that no, this is the proper and best effective way to improve your health problems. The timing should be appropriate. The information overload is to be avoided means we have to give specific informations, not in detail means whatever is necessary you should tell them only. The things which are not necessary and which may not understood by the village people or community people, so we have to avoid that. Then next is IEC in nursing. The next is IEC in nursing at individual level. First point, at individual level provides opportunity to develop personality, knowledge, skills and confidence. Means we have to provide opportunity to develop their personality, their knowledge and skills and confidence. Then next is it increase awareness. Then third is reinforcement to sustain behavioral change. Communication is very important in nursing practice means we have to communicate with the village volunteers, with the community pupils and with the patients who are having health problems. Then at community level, the role of a nurse in family planning programs with IECR means what are the role of a nurse in family planning programs with information, education and communication. First is informing means she should inform. Then second is persuading, she should persuade means she should inform and she should identify and she should take the details of the patient. Okay, then motivating, she should motivate to the patient and she should give proper counseling to the patient and their relatives for the proper birth and proper delivery. Okay, proper family planning methods, what are the temporary methods and what are the permanent methods of family planning. Okay, then encouraging, she should encourage the couples to take advice to the proper doctor, proper gynecology. They should go to the hospital for the delivery purpose. Hospital deliveries are safe. Okay, so she should encourage the patients. Then family health services. Introduction of family health services. Family healthcare nursing is an art and a science that has evolved over the last 20 years as a way of thinking about and working with families. Family nursing comprises a philosophy and a way of interacting with clients that affects how nurses collect information, intervene in patient, advocate for patients, and approach spiritual care with families. फैमिली हेल्थ केयर नर्सिंग क्या है? फैमिली हेल्थ केयर नर्सिंग इज एन आर्ट एंड साइंस. मीन इट इज एन आर्ट एंड इट इज ए साइंस that has evolved over the last 20 years. Means it was coming up from the last 20 years as a way of thinking about and working with families. Means it is the way of thinking and to work with the families. Family nursing comprises a philosophy and a way of interacting with clients. Means family nursing comprises that how nurses interact with the clients and how they collect information and how they implement the procedures to that patients and how they advocate the patients with spiritual care with and approach spiritual care with families, and they also approach spiritual care to the families. Then introduction of family health services. Then definition of family. What is family? Two or more individuals coming from the same or different kinship groups who are involved in a continuous living arrangement, usually residing in the same household, experiencing common emotional bonds and sharing certain obligations toward each other and toward others. Means two or more individuals coming from the same or different kinship group. Means if two people come together, either they may be of same family, same blood group or same relatives, or either may be of different, who are involved in a continuous living arrangement. Means who both are living in and both are enjoying same living arrangement and usually residing in the same household. Means they both are living in the same house and sharing certain obligations toward each other and toward others. Then family health, a condition including the promotion and maintenance of physical, mental, spiritual and social health for the family unit and for individual family members. What is family health? In that it includes the promotion and maintenance of physical, mental, spiritual and social health for the family unit or an individual family members. Then next is family process. What is the family process? The ongoing interaction between family members through which they accomplish their instrumental and expressive tasks. The nursing process considers the family, not the individual, as the unit of care. What is family process? It is an ongoing interaction between family members. Means what are the interactions? Maybe they cook together, they sleep together, they talk, they walk. No. These are the interactions between family members which they accomplish their instrumental and expressive tasks. Means which they accomplish with the instrumental or expressive tasks. The nursing process considers the family, not the individual, as a unit of care. It means in that nursing process is made for the family, not a particular individual, because if we have to provide care in the family, so we have to take all the members of the family, not a particular individual in that family. Then family centered nursing. What is family centered nursing? Nursing that considers health of the family as a unit in addition to the health of individual family members. Family centered nursing is what is the family centered nursing? Nursing that considers health of the family as a unit. Means what are the nursing cares we have to provide in the family in addition to the health of individual or family members. Sometimes we have some particular person is sick in that family, so we have to provide that care, but it is also known as family centered nursing. Then next is the family health nursing. Definition and meaning of family health nursing. Family health nursing is a nursing aspect of organized family healthcare services which are direct or focused on family as a unit care with the health as the goal. It is the synthesis of nursing care and health care. What is family health nursing? Family health nursing is a nursing aspect in that healthcare services may be organized for the family or the family members, and it may be directly focused on the family as the unit of healthcare, and our goal is to provide healthcare services to the family member, to all the family members. Okay, it is the synthesis of nursing care and healthcare, in that we can provide nursing care to the family members or healthcare to the family members or particular individual in that family. The goal of the family health nursing include optimal functioning for the individual and for the family as a unit. What is the goal for the family of the family health nursing? It include optimal functioning for the individual, means a nurse should perform and a nurse should provide particular care to the particular nursing processes to the family as a unit. She considered to the family as a unit that she should provide a health care facility to the all family members to the in that family, and in that family if particular person is sick, so she should concentrate on that person more. Then objectives of family health nursing: to identify health and nursing needs and problem of each family, to ensure families understanding and acceptance these needs and problems, to plan and provide health and nursing services with the active participation of family members, to help families develop abilities to deal with their health needs and health problems independently, to contribute to families' performance of developmental functions and tasks, to identify health and nursing needs and problems of each family functions and tasks, to educate, counsel and guide family members to cultivate good personal health habits, practice safe cultural practices and maintain wholesome physical, psychosocial and spiritual environment. Then next is family-centered nursing approach. What are the approaches of family-centered nursing? First, family as the context, means we should focus on the family, not in the individual member. Then family as the client, means we should consider family as our patient, the whole family as our patient, not an individual person. Then family as a system. Then a nurse should know that a family as a system, means if one person is infected with some diseases, so other may get some little bit of illness or infection in that family. Okay, then family as a component of society, means family is a component of society. The nurse should know a society means a family, means a society, a component of society is a family, means a family is a part of that society. Okay, so we have to take all the family members together and we should provide the great care to all the family members. What are the nursing process and what the benefits we have to provide for the health related problems to that family, we should advise and we should tell them. The next is role of family nursing. First is health teacher, then coordinator, collaborator and liaison, deliver and supervisor of care and technical expert, then family advocate, then consultant, then counselor, then case finder and epidemiologist, then environmental modifier, then clarifier and interpreter, then surrogate, then researcher, then role model and at last case manager. So that's all for the topic. Thanks for listening. So tomorrow we will come with new and latest topic. So thank you all.